After 65, every bite matters a little more. The body doesn't process sugar like it used to, and even natural sugar from fruit can cause trouble if you're not careful. Some sweet fruits that once seemed harmless might now be spiking your blood sugar, irritating your digestion, or quietly adding to inflammation. On the flip side, there are other fruits packed with nutrients that can protect your memory, ease joint pain, and even help you sleep better. It's not about cutting fruit out. It's about knowing which ones to keep close and which ones to keep off the plate. This video will walk you through exactly that, with clear, gentle guidance tailored for your stage of life. Stay healthy after 65. Subscribe for trusted advice. Share your fruit experiences or questions in the comments below. Pineapple. Pineapple may seem like a refreshing tropical treat, but for those over 65, it can cause more harm than good. This fruit is naturally high in sugar and acidity, two things the aging body often struggles to handle. The high sugar content in pineapple, particularly fructose, can spike blood glucose levels more quickly than many other fruits. Some doctors warn that this rapid increase in blood sugar can be especially risky for older adults with diabetes or those managing insulin resistance, both of which become more common after the age of 60. Even small portions of pineapple can contribute to blood sugar instability, which over time may lead to fatigue, inflammation, and other metabolic issues. Pineapple's acidity is another concern. With age, the stomach lining becomes more sensitive, and acid reflux or indigestion may become more frequent. Eating acidic fruits like pineapple can irritate the stomach lining, increasing the risk of heartburn and gastrointestinal discomfort. This is particularly problematic for those who already experience acid reflux or are on medications that affect stomach acid levels. In some cases, the irritation can lead to bloating or even a burning sensation in the chest or throat, which may be mistaken for more serious conditions. Another issue with pineapple for older adults is its impact on dental health. As enamel naturally thins with age, teeth become more vulnerable to acidic erosion. The citric acid in pineapple can wear down this protective layer, leading to increased sensitivity, discomfort while eating, and a higher risk of cavities. Dentists often caution seniors about regularly consuming highly acidic foods, and pineapple ranks near the top of that list. Combined with its sticky texture, which clings to teeth and feeds oral bacteria, pineapple can quietly contribute to a decline in dental health if consumed too often. While pineapple does contain beneficial nutrients like vitamin C and bromelain, the risks it poses to seniors often outweigh these benefits. There are other fruits that offer similar nutrients, without the drawbacks of high sugar and acidity. For seniors trying to protect their digestion, stabilize their blood sugar, and maintain dental health, limiting or avoiding pineapple may be a wise and protective choice. Mango. Mango is often celebrated for its rich flavor and creamy texture, but for seniors, especially those managing diabetes or pre-diabetes, it can quietly undermine blood sugar control. Mango ranks high on the glycemic index, meaning it causes a sharp rise in blood glucose shortly after consumption. While younger bodies may tolerate these spikes more easily, older adults often experience slower insulin response and reduced glucose tolerance. Some doctors caution that fruits like mango with a glycemic index around 60 and high natural sugar content can contribute to sudden energy crashes, elevated insulin levels, and long-term metabolic imbalance. A single medium-sized mango contains more than 45 grams of sugar, mostly in the form of fructose and glucose. For comparison, that's more sugar than a standard 12-ounce can of soda. For seniors already monitoring carbohydrate intake, especially those using medications or insulin to manage diabetes, this level of sugar in one serving can push blood glucose into an unsafe range. Even those not formally diagnosed with diabetes may be at risk. As metabolism slows with age, the body's ability to clear excess sugar from the bloodstream declines, increasing the chance of developing insulin resistance over time. Mango also has a low fiber-to-sugar ratio, which means it lacks the natural slowing effect that fiber has on sugar absorption. Without this buffer, the body processes mango's sugars rapidly, leading to a sharp rise and then a fall in blood sugar. This roller coaster effect can cause fatigue, irritability, and even dizziness, especially in older adults whose systems are less flexible. Studies show that repeated blood sugar spikes not only affect energy and mood, but also increase the risk of cardiovascular complications, which many seniors are already at higher risk for. While mango does provide vitamins A and C, the high sugar impact often outweighs the nutritional benefit for those over 65. Some nutritionists recommend limiting or avoiding mango entirely if blood sugar control is a concern. For seniors working to manage weight, support heart health, or reduce the risk of type 2 diabetes, being cautious with high glycemic fruits like mango is a small change that can offer lasting protection. Choosing fruits with lower sugar and higher fiber is a safer, more balanced way to enjoy natural sweetness without compromising health. Lychee. Lychee is a fruit that looks harmless on the outside, but its high sugar concentration and potential to increase inflammation make it a risky choice for seniors. Though it's small and often eaten in multiple pieces, just 1 cup of fresh lychee contains over 29 grams of sugar. That's a considerable load for older adults, especially those managing blood sugar concerns or conditions linked to inflammation. The body's ability to regulate sugar and inflammatory responses tends to decline with age, and consuming high-sugar fruits like lychee can quietly aggravate both. One of the lesser-known concerns with lychee is its connection to systemic inflammation. High sugar intake is known to trigger inflammatory responses in the body, and lychee's combination of glucose and fructose can contribute to that process. This is especially troubling for seniors with joint issues such as osteoarthritis or rheumatoid arthritis, where even small increases in inflammation can lead to more stiffness, swelling, and pain. Some doctors warn that chronic low-grade inflammation, often made worse by sugary foods, is one of the key drivers behind many age-related health conditions. In addition to sugar, lychee contains certain natural compounds that, in large amounts, or when consumed on an empty stomach, have been linked to metabolic disturbances. While this is mostly a concern in undernourished individuals, seniors who are sensitive to rapid changes in blood glucose should still approach lychee with caution. The fruit's impact can be more intense in older adults whose glucose metabolism is already slowed or irregular. Inflammation doesn't just affect the joints, it can quietly strain the entire system, including the heart, blood vessels, and brain. Research shows that diets high in sugar contribute to oxidative stress and the release of pro-inflammatory chemicals in the body. This places added burden on systems already weakened by age, making it harder to recover from minor injuries or illnesses. For seniors dealing with chronic pain or fatigue, eliminating high-sugar fruits like lychee may offer relief they hadn't expected. Although lychee offers vitamin C and antioxidants, these benefits can be outweighed by its sugar load and inflammatory potential for older adults. For those seeking to protect their joints, reduce flare-ups, or maintain steadier energy levels, skipping lychee or saving it for rare occasions may be a simple but meaningful change. Making choices that ease inflammation, even in small ways, can help support better mobility and comfort as the years go on. Grapes. Grapes, whether red or green, may seem like a light and healthy snack, but for many seniors they carry hidden risks that are often overlooked. These small fruits are packed with natural sugars, mainly glucose and fructose, that can cause a rapid rise in blood sugar. A single cup of grapes contains around 23 grams of sugar, with minimal fiber to slow absorption. For older adults, particularly those managing diabetes or prediabetes, this quick spike can place unnecessary strain on insulin function and lead to long-term instability in glucose levels. Some doctors warn that fruits with high sugar and low fiber, like grapes, should be eaten sparingly or avoided altogether by those in this age group. Beyond sugar, grapes are also a concern because of their high pesticide residue levels. According to data from the Environmental Working Group, grapes consistently rank among the most pesticide-contaminated fruits. Even when washed, traces of these chemicals can remain, and over time they may affect the body's immune response. Seniors, whose immune systems may already be weakened by age, medications, or chronic conditions, are more vulnerable to the long-term effects of chemical exposure. Some studies suggest that certain pesticides may interfere with hormone regulation and immune cell activity, increasing the risk of inflammation and cellular stress in older adults. Grapes can also be problematic for seniors with existing kidney or liver conditions. Both organs are responsible for filtering waste and processing compounds from the foods we eat, including natural sugars and pesticide residues. For someone with reduced kidney or liver function, the burden of breaking down these components may be too high. In particular, fructose can be harder on the liver, and excess consumption over time may worsen fatty liver disease or increase uric acid levels, which can also affect kidney health. Doctors often advise patients with compromised liver or kidney function to limit or avoid fruits like grapes that are high in sugar and low in fiber. While grapes do contain antioxidants like resveratrol, these benefits do not outweigh the risks for many older adults. The sugar content, potential chemical exposure, and stress on vital organs make grapes a fruit that's better avoided when trying to manage health after 65. For seniors working to maintain stable energy, support their immune system, and protect their organs, steering clear of grapes, especially in large quantities, can be a small but impactful choice. Focusing on fruits with lower sugar, higher fiber, and fewer pesticide concerns offers a safer path to lasting wellness. Blueberries. Blueberries are one of the most powerful fruits seniors can include in their diet, especially after the age of 65. These small, deeply colored berries are packed with antioxidants, particularly a type called anthocyanins, that are known to help preserve brain health and slow age-related cognitive decline. Several studies have shown that regular consumption of blueberries may improve memory, support faster information processing, and enhance mental clarity in older adults. Some researchers suggest that the antioxidants in blueberries help fight oxidative stress in the brain, which is believed to contribute to memory loss and neurological aging. By protecting brain cells from damage, blueberries may play a role in keeping the mind sharper, longer. Beyond brain health, blueberries also offer powerful anti-inflammatory properties. Chronic inflammation is a common concern in seniors as it's linked to many age-related conditions, including arthritis, heart disease, and high blood pressure. The compounds found in blueberries may help reduce the inflammation that builds up in joints and blood vessels over time. Some doctors point to the way blueberries help neutralize free radicals, unstable molecules that can damage tissues and trigger inflammation. This protective effect can ease discomfort in joints and may help maintain mobility and flexibility, making daily movement easier and less painful. Blueberries also support cardiovascular health in a number of ways. In addition to reducing inflammation in blood vessels, they have been shown to improve circulation and may help lower LDL cholesterol and blood pressure. According to findings from several clinical trials, older adults who consumed blueberries regularly saw modest improvements in blood vessel function, which is important for reducing the risk of heart attack and stroke. The fiber and plant compounds in blueberries also support better blood sugar control, helping to stabilize glucose levels over time, a key benefit for seniors managing prediabetes or diabetes. Another reason blueberries are particularly well suited for older adults is that they are low in sugar compared to many other fruits. This makes them a safer and more reliable option for those who want to enjoy something naturally sweet without compromising their blood sugar balance. They are also easy to digest and gentle on the stomach, making them suitable even for those with sensitive digestive systems. For seniors focused on staying mentally sharp, protecting their joints and supporting their heart, blueberries are more than just a tasty snack. They are a strategic, science-backed choice. A daily serving of fresh or frozen blueberries can quietly but powerfully contribute to long-term health, vitality, and independence. Apples, especially when eaten with the skin, provide several health benefits that are particularly important for seniors over the age of 65. One of the most valuable nutrients found in apples is fiber, specifically a type called soluble fiber, which plays a key role in supporting digestion and heart health. As the body ages, digestion can become slower or more sensitive, and the risk of constipation increases. The fiber in apples helps promote regular bowel movements by adding bulk and improving intestinal function, which can bring relief and comfort. to those experiencing digestive discomfort. Beyond digestive health, soluble fiber in apples has been shown to help lower LDL cholesterol, the so-called bad cholesterol that contributes to plaque buildup in the arteries. By binding with cholesterol in the digestive system and helping to remove it from the body, apples support better heart function and circulation. Some research has shown that people who eat apples regularly tend to have healthier cholesterol levels, which may reduce the risk of heart disease, a leading concern for older adults. In addition to fiber, apples are rich in plant compounds known as flavonoids, which are concentrated in the skin. These natural antioxidants have been studied for their ability to protect cells from damage and reduce inflammation in the body. Certain flavonoids in apples, such as quercetin, are believed to offer specific benefits for both heart and lung health. Some researchers have observed that quercetin may help relax blood vessels, lower blood pressure, and reduce the burden on the heart. Others suggest it may also support healthy lung function by reducing airway inflammation, which can be helpful for seniors managing asthma or mild respiratory issues. For older adults, lung health is a growing concern, especially after years of exposure to pollution or respiratory infections. Apples may offer a gentle, food-based way to help maintain clearer breathing and lung resilience. In a large study involving older adults, those who consumed apples more frequently appeared to have better lung function over time compared to those who did not. While apples are not a cure, their protective compounds make them a smart and simple addition to the diet of anyone aiming to breathe easier and protect their heart. It's important to eat the apple with the skin intact, as most of the fiber and flavonoids are concentrated there. Peeling the apple removes many of the beneficial nutrients that make this fruit such a valuable ally in senior health. For those looking to improve digestion, lower cholesterol, and support lung and heart, wellness apples offer a natural and effective choice backed by research and expert recommendation. Avocado. Avocado offers a unique combination of nutrients that can be especially beneficial for seniors over 50. Its most notable feature is the high content of healthy fats, specifically monounsaturated fats, which support heart health by helping to lower LDL cholesterol while maintaining or even increasing HDL cholesterol, the good type. These heart-healthy fats are also linked to improved circulation, which is essential for maintaining energy and organ function with age. The American Heart Association notes that replacing saturated fats with unsaturated fats, such as those found in avocados, may help reduce the risk of cardiovascular disease, a major concern for older adults. Beyond the heart, these fats play an important role in brain function. Several studies have pointed to the benefits of monounsaturated fats in preserving cognitive function, particularly as the brain ages. Avocados contain lutein as well, an antioxidant shown in research to support cognitive health and visual processing. In older adults, maintaining mental clarity and slowing memory decline are top priorities, and the nutrients in avocados may offer natural support. Some researchers have found that individuals who regularly consume monounsaturated fats have better memory recall and cognitive performance compared to those who consume more saturated fats or refined carbs. Avocados are also excellent for skin hydration, which tends to become more difficult with age. Dryness, thinning skin, and slower repair are common issues in seniors, and the healthy fats in avocado help nourish skin from within. These fats support the skin's natural barrier, keeping it soft, supple, and more resistant to environmental damage. Additionally, avocados provide vitamin E, a fat-soluble antioxidant known to support skin repair and elasticity. For seniors dealing with dry or fragile skin, this fruit may offer gentle daily nourishment. Another key benefit of avocado is its ability to support blood sugar stability. Although it's technically a fruit, avocado is very low in carbohydrates and does not cause rapid spikes in blood glucose levels. This makes it a smart food choice for seniors managing diabetes or insulin resistance. According to some studies, the monounsaturated fats in avocados may improve insulin sensitivity, helping the body respond more effectively to blood sugar fluctuations. This is particularly important because blood sugar instability can lead to fatigue, mood swings, and long-term complications like nerve or kidney damage. Finally, avocados contain compounds that may help reduce chronic inflammation, a root factor, in many age-related conditions including arthritis, cardiovascular disease, and even cognitive decline. The combination of healthy fats, antioxidants, and anti-inflammatory plant compounds in avocados makes them a valuable food for reducing inflammation gently and naturally. For seniors aiming to protect their heart, brain, skin, and overall well-being, avocado stands out as a nutrient-dense, supportive choice, backed by research and trusted by health professionals. Kiwi. Kiwi provides a strong and reliable boost of vitamin C, which plays a vital role in maintaining immune health, especially crucial for adults over the age of 50. As we age, the immune system naturally becomes less efficient, making the body more vulnerable to infections, slower wound healing, and chronic inflammatory conditions. This decline in immune strength can leave older adults more susceptible to seasonal illnesses, viruses, and general fatigue. Thankfully, one medium-sized kiwi delivers more than the recommended daily intake of vitamin C, offering a simple yet powerful way to support the body's natural defenses. For seniors who may not tolerate supplements well, or are seeking more natural sources of nutrients, kiwi is a convenient and delicious solution. Research has consistently shown that older adults who maintain sufficient levels of vitamin C tend to experience fewer respiratory infections, such as colds and bronchitis, and often recover faster when illness does strike. This isn't just about preventing the sniffles, it's about building a foundation of health that can reduce complications and hospital visits. Vitamin C's potent antioxidant properties also play a role in protecting cells from oxidative stress, which builds up over time and contributes to aging, cellular damage, and the development of chronic diseases like heart disease and cognitive decline. By strengthening the body's first line of defense and enhancing the function of white blood cells, kiwi empowers the immune system to be more responsive, more efficient, and more resilient, qualities that become increasingly important with age. Beyond immune support, kiwi offers powerful digestive benefits, making it a multitasking fruit for aging wellness. As the body grows older, digestion often becomes less efficient. Many seniors experience bloating, gas, and indigestion, especially after protein-rich meals. Kiwi contains a natural enzyme called actinidin, which helps break down proteins in the stomach. This enzyme mimics the body's own digestive enzymes, promoting better nutrient absorption and easing the workload on the digestive system. It's especially helpful after large meals or when the body's enzyme production has slowed due to age. Additionally, kiwi is rich in both soluble and insoluble fiber, which work together to regulate bowel movements and prevent constipation, a very common issue among older adults. Soluble fiber forms a gel-like substance that softens stool, while insoluble fiber adds bulk and promotes movement through the digestive tract. For seniors who struggle with irregularity, this natural combination found in kiwi can offer consistent relief without the need for harsh chemical laxatives. In fact, some studies have shown that eating kiwi regularly improves gut motility and reduces reliance on over-the-counter digestive aids. Moreover, the fiber in kiwi also nourishes healthy gut bacteria, which play a broader role not only in digestion, but also in immune response and mental clarity. A well-balanced gut can significantly impact how a person feels both physically and emotionally, especially in older age. Another remarkable advantage of kiwi is its potential to naturally enhance sleep quality. Sleep disturbances are a common concern among seniors, often caused by hormonal changes, side effects of medications, or chronic health conditions like arthritis or anxiety. Kiwi contains serotonin, a naturally occurring compound that helps regulate the sleep-wake cycle. Serotonin is a precursor to melatonin, the hormone that signals the body to rest. In one study involving older adults with mild sleep disturbances, participants who consumed 2 kiwis 1 hour before bedtime reported falling asleep more quickly, sleeping more deeply, and feeling better rested upon waking. Unlike many sleep aids, which can cause grogginess or dependency, kiwi supports the body's natural rhythm in a gentle and side-effect-free way. In addition to serotonin, the high antioxidant content in kiwi, including vitamin C, vitamin E, and various plant polyphenols, helps reduce inflammation and oxidative stress in the brain and body. These stresses are often behind restless nights and poor sleep quality. By calming the nervous system and reducing internal inflammation, kiwi may contribute to more peaceful and restorative sleep, helping seniors feel more alert and refreshed during the day. For adults over 50 who are looking for a natural way to support immunity, aid digestion, and promote better sleep, kiwi offers a well-rounded, research-supported solution. It's not a miracle cure, but rather a gentle, effective ally that works with the body's natural processes. The combination of essential vitamins, beneficial fiber, sleep-supporting compounds, and powerful antioxidants makes kiwi a smart, low-effort addition to any senior's daily diet. Including just 1 or 2 kiwis per day can deliver noticeable benefits without relying on supplements or medications. In a time when many older adults are seeking safer, more natural alternatives to support their health, kiwi stands out as a simple fruit with a surprisingly wide range of health benefits, helping seniors feel more energized, protected, and at peace, one bite at a time. Thank you for spending time learning about these important fruit choices for your health after 65. Making mindful decisions about what you eat can truly make a difference in how you feel every day. Remember, small changes like adding nutrient-rich fruits and avoiding those that may cause harm can protect your heart, brain, and overall well-being. Stay connected with trusted advice, listen to your body, and prioritize what nourishes you. Best, if this video helped, please like, share, and subscribe for more gentle guidance designed just for you. Your health matters, and every step counts toward a stronger, happier life.